The World Health Organization is calling it an historic step for the children of Cameroon. The country is launching the world's first malaria vaccination program for infants. The new jab will be offered free of charge and nationwide to all children under 6 months. The rollout comes after successful trials in Ghana, Kenya and Malawi, which showed the vaccine slashed mortality for infants who did get infected with malaria. Now, the mosquito-borne disease kills more than 600,000 people a year, 95% of those in Africa, where children under 5 make up more than 80% of deaths. Now, this comes after Cape Verde became the latest African nation to be certified as a malaria-free. Now, the head of WHO said the news was a beacon of hope for the elimination of the disease.
This achievement sends a clear message to the world that with political will, strong partnership, and the full commitment of every partner, the elimination of malaria is possible anywhere.
But that's not yet so in Cameroon. Almost a third of all medical consultations are malaria-linked, and WHO figures say 11,000 people die of the disease there every year. Though a vaccine is a significant step in the fight against malaria, not everyone is willing to have their child vaccinated.
Baby Therese is just 6 months old, but today she's getting her first dose of vaccine. Cameroon's launch of universal malaria vaccination is a global first. Adele Jana is a mother of 3, and she was eager for her chance. For her family, the new jab is essential.
I'm happy they finally produced this vaccine. My first child was very sick with malaria. He had convulsions, and tests showed that it was caused by malaria. That's why I don't want to take chances with my other children. I take vaccination seriously.
At the hospital, other mothers are waiting their turn to have their children vaccinated. They have good reason to take up the inoculation. Malaria remains a major public health problem in Cameroon. Officials are convinced that the vaccine can help.
We have an additional tool that will complete the range of instruments we have for preventing malaria. And obviously the hope is that we will see a rapid decline in malaria morbidity and mortality.
For the time being, the vaccine is only available in a few clinics like this one. But not all mothers have agreed to have their children vaccinated. The plan is to include the jab in the regular childhood inoculations. In Douala, Audrey Stella came for the routine vaccination of her 6-month-old baby. But then, she turned down the malaria vaccine.
The reason I didn't agree is because I wasn't aware of it. I didn't know it existed. We never spoke about it. If we talk about it everywhere, maybe in the media, door to door, if people are informed, then it will mean that we're prepared and that we know that a vaccine like that exists. Then we won't be surprised and all would be okay.
Despite the drawbacks such as limited efficacy and availability, the vaccine's ability to slash infant mortality makes it a game changer. And another one is in the pipeline. The biggest challenge will be convincing parents to bring their children to the clinic for the jab.
So, how transformative is the new malaria vaccine? Rose Leke is Professor of Immunology and Parasitology at one of the world's leading malaria experts. She told me what the most important number will be in measuring the success of this vaccination program.
How many of these mothers were able to convince to take their children for vaccination at 6 months? I say that because there's been quite a lot of vaccine hesitancy. And so the government has really brought up a good communication plan. And we're hoping that that communication plan will go right down to the rural areas, the villages, and really convince those mothers that have to bring their children for vaccination. I had the experience a few weeks ago with others when we met mothers who came for routine immunization, and we talked to them and said, "You've come to vaccinate your child?" "Yes." Have you heard about the malaria vaccine? It had just arrived to Cameroon. And they said, yes, we've heard about that vaccine, but we're not coming for it now at all until we get more information, because we're hearing different people saying different things about it. It's a little bit scary for us. So we are not coming for that vaccine now.
Yeah, and I guess shoring up public confidence is going to be necessary across the continent, because the hesitancy that you're describing is not unique to Cameroon. But we know that the Cameroonian government is rolling out this vaccination program for free. Do you know about plans for the rest of the continent? Is there enough vaccine for every newborn in Africa?
I can really answer that question because I co-chaired the framework that the Global Malaria Program, designed. I co-chaired this with Professor Helen Rees in South Africa. And it was a framework for the equitable distribution of limited supplies of the malaria vaccine. Because it was from 4 to 18 million for 3 years. And, of course, what we need in Africa is about 100 million doses for 3 years for that time. So what happened was the Global Malaria Program, the vaccine area, then put up the development of this framework and got malaria experts from all over the world to sit together and then look at it, the criteria, be it ethical, be it, what in a country, the prevalence, the morbidity, what will it take? Where do we start from? We had to use all these criteria then to define each country, from category 1, category 2, 3, 4, 5. So category 1s are the ones now that have, the higher impact, prevalence is high, mortality is high. In this category 1 areas in the country, the highest anyway. So they are the ones now that have the vaccine. The category 1 areas in all, that's why you'll see certain areas in countries and not the entire country. And so when we get more vaccines, it might then go to the category 2 areas. But also that apart from the RTS, we're hoping that the R21, which is about the same molecule, but about the same, kind of class of it, they talk of molecular aspects, is the same kind of the peptides that you're using here. So talking about that, the R21 is coming also. And we're hoping that with the R21 vaccine, hopefully, once it gets WHO pre-qualification, we can also have that vaccine added on. And I think with that, we can have bigger quantities of the R21 to add on to the RTS. And so we can have enough for all the countries in Africa. We're hoping that will happen soon.
Professor, you've dedicated your life's work to malaria research. You've said that malaria is the reason you decided to practice medicine. I just wonder what this moment means for you, especially with the first rollout of the malaria vaccine being in your home country, Cameroon.
I feel, really being a Cameroonian, I'm happy and proud and I was looking forward to, we've all in malaria, looking for the vaccine. It has taken a long time for us to come to even this first vaccine. True, you can say it's not the best, but it is the first, and it will have an effect. So to me, I'm really happy to say it and proud that it's starting in Cameroon. But then I can't be proud if the uptake isn't there, if we really cannot get the numbers of children that we wanted to see vaccinated, the vaccines are there. Let's see, if we cannot do that because of this hesitancy, that will really make me very sad. But anyway, we have time doing all this communication. Government is really putting in efforts. Gavi is, the Global Malaria Program is, and the governments too. And so we're really hoping that we can see, it's really the society to accept this. We have to take ownership of this fight against malaria. And it's not there yet. We need mindset change in our society, which is really not there. But with the communication that we're having, we're hoping that it will at least, make some kind of a difference. We'll all see this, what happens together, and see whether we can really smile or put our heads down.
Well, I, for one, am hoping that we'll be smiling. Professor Rose Leke, as always, thank you very much for your insights.